science itself.
Thank you, Senator Hawley. And now, Senator Alsobrooks.
Thank you so much, Mr. Chair. Good morning, Dr. Bhattacharya. I know you've had great experience at NIH, and so it goes without saying that NIH is a crown jewel, not only in the state of Maryland, which happens to be my state, but it's a crown jewel for our country, where we have many, many talented scientists and researchers who are there. That brings me to a quick line of questioning I have. I want to sound the alarm that some very dangerous things are happening to scientists and researchers at NIH right now. And I want to ask you whether you believe that it is appropriate, and you mentioned a moment ago about a concept around knowledge and freedom for scientists, and whether you believe it is appropriate under any circumstance to retaliate against scientists or medical researchers based on the research they have done. Do you believe that?
No, Senator, I've been subject to that myself. I know what it's like to be subject of devastating takedowns by top officials at the NIH specifically, and I will never do that. I absolutely commit to making sure that scientists are treated respectfully, especially those that disagree with me.
Now, you've even said that you believe, and you've spoken out against a culture of conformity in science and have criticized institutions that you allege destroy the reputations of scientists who do not conform with their viewpoint. I believe that is what is happening right now at NIH. In fact, your soon-to-be boss, Mr. Kennedy, when I questioned him about whether or not he would supplement his judgment for that of scientists, he said he intended to replace bad scientists with good scientists. Is this your viewpoint as well?
Well, Senator, I think that science is. I don't know exactly what the nature of that conversation, but I think that the way that you decide what is good and bad science is by conversation, by data, by replication. I'm absolutely committed to making sure that those processes are in place at the NIH.
Okay, and you agree that we should never retaliate or even fire a scientist because of his or her peer-reviewed work that they publish.
Senator, I think retaliation and conflict that characterize the kind of discussions that we had among scientists, that comes from the top of the scientific institutions, and I commit to making sure. In fact, it's one of the 5 points I emphasized in my opening statement, that we have allow a culture of dissent and respectful conversation about scientific matters rooted in data at the NIH.
Okay, I just want to ask you about one other area of concern. It is no secret that this administration feels absolutely triggered by any mention of equality, any mention of inclusion, and the president himself, in his own words last night, essentially said America intends to erase any reference whatsoever to race or gender. Having said that, I'd like to refer to a study that you co-authored called Persistent Racial Disparities in Survival Following Heart Transplantation, and to ask you whether or not, because I understand there are some watch lists that have been created, whether you believe that on the basis of this study, should that work be placed on a DEI watch list because it references racial disparities?
Senator, I'm not aware of any watch lists. I don't intend to implement any watch lists. I will say this, that the health needs of the minority populations in this country are a vital priority for me. In fact, the health needs of every single American are a vital priority for me. I want to make sure that the research that the NIH does addresses those health needs. And I don't see anything in the President's orders that contradict that. In fact, quite the contrary. What I've heard from the Secretary and from the President is let's make America healthy, meaning all Americans.
Yeah, I know. I don't want to be naive, though. He did mention that he is absolutely triggered by anything that mentions equality or inclusion or any reference to race or gender. And so the center that you co-direct, the Center for Advancing Socio-Demographic and Economic Study of Alzheimer's Disease and Related Dementias, mentions that your mission is to diversify the set of researchers who are working in the field. And I want to know whether or not, based on that, and that it also mentions mentoring diverse scholars, which I think is a reference to race and to gender and to people with different backgrounds. And so whether you believe that this project, which received, by the way, $872 million in taxpayer dollars, $800 million in taxpayer dollars.
Not that much, but
that's right. Yeah,
it was less than that. But yeah.
Well, was this a radical and wasteful use of government spending on the basis of it doing this?
Senator, I'm proud of that project.
Yeah, work.
Senator, first, I'm proud of that project. It's addressing Alzheimer's disease, and I'd say further that the idea that diverse scientists, I think to me, what that means is scientists with diverse ideas about scientific topics. I think fundamentally what matters is, does a scientist have an idea that advances the scientific field they're in? Do they have an idea that ends up addressing the health needs of Americans? That's the key thing. And to me, that diverse set of ideas, allowing there to be a diverse set of ideas, people who disagree with each other, is fundamental to advance in science. I think free speech, and I think we...
That includes racial disparities. That's the work you've done, right?
Well, racial disparities are important to identify, but more important is to address the health needs of every American, no matter whether they're minorities or not.
Thank you so much. I yield. Thank
Thank you, Dr. Alsobrooks. Very good sneaking that last comment in. You know what I'm saying? After the buzzer. Senator Husted.